My name is Neelish Goswami, and I'm an interventional cardiologist with Prairie Cardiovascular in Springfield, Illinois at St. John's Hospital. I recently had the opportunity to visit a mission in India called Central India Christian Mission. And these folks already have a hospital in a rural part of India there, but now they wish to expand their services to cover cardiology care. What became clearly apparent on our arrival to Damoh was there's a lot of people in India with heart disease. And not only is there a lot of people in India with heart disease, but there's a lot of people in India with heart disease that don't have access to specialists like cardiologists. So the second day of my visit to the mission hospital in Damoh, they had arranged a cardiology camp, and to my amazement, over 400 patients showed up with cardiology problems for me to see that day. And although clearly I couldn't see all of them, the patients that I did see were ill, clearly needed a higher level of cardiology care, but did not have access to it there locally.
Well, we were so thrilled to hear about this possibility of sending a cath lab to India. And Dr. Goswami contacted us and let us know about the inspiration he received from traveling to India, and the fact that St. John's was getting a new cath lab and that they have a really great one that they want to donate to India. So he contacted us and said, "Can Mission Outreach help?" And we said, "Absolutely." We've never shipped an entire cath lab, so that's a real thrill for us. Even with this generous donation of the cath lab, there are costs involved in shipping something that major, shipping a 40-foot shipping container to India. There's costs with shipping, there's costs with packaging and coordination. So he was inspired in India, he came back, inspired us, and now many people are involved in this initiative to get a cath lab to India.
Well, as the board chair for Mission Outreach, I thought this was a perfect opportunity for St. John's Hospital to partner with Mission Outreach. This again was a great way to be able to work with an organization whose mission is to supply medical supplies to organizations in need to care for people who are in need in countries that may not be as advantaged as the United States. So we're again really pleased to be able to do this because it meets both the mission of St. John's and the mission of Mission Outreach.
You know, I'm so impressed with Dr. Goswami when he went to India and saw the many people that had heart disease, and he wanted to do something about that. And now he's going to set up a cath lab. They're building a facility to house that. That's a big venture for one person to take on. What a great opportunity for the people to get help in managing or taking care of heart disease that we so readily in this country have it right at our fingertips. And what a blessing for the people there that he's going to help them. Mm-hmm.
Although we have a lot of volunteers and people in place to work out the logistics of getting this container from Springfield to Damoh, India, we don't have the funds. And the cost of shipping this container is $50,000 from Springfield, Illinois to Central India. And that's what we'd like to ask your help with. I realize that's a lot of money by anyone's standards, and we are judiciously trying to raise all of that so we can truly make this happen and change the lives of those people in India, millions of people in India. In this country, sometimes we take health care for granted. We live in a small town of 117,000 people, Springfield, Illinois, and in that town we have 13 cath labs. Damoh and its surrounding area, several million people, maybe up to 20 million people, no cath lab. We can change that. We can change it together, and we can change it with your help.